Okay, how are you?
Good to be with you, Senator.
Okay, I want to welcome everyone to Straight Talk. Those that know me and those who don't, this is Senator Gerald Neal. This is my weekly noon attempt to share information. We're doing something a little different this morning. I have as my very first special guest, the number one in Louisville Mayor's Greg Fischer. So we're delighted that he's here. I want you to know that we're coming via Zoom. We're streaming through Facebook. So I'm hopeful that I did this right because I'm a novice at it, but I'm going to get better as I go along. I would request that each of you that are viewing share the event to your contacts and friends and ask them to do the same, because the whole idea is to get the information out as best as possible. We're going to deal with several things, but first I want to give you a little background on our special guest this morning. Greg Fischer is the 50th mayor of Louisville, Kentucky, the 50th. He was first elected in November 2010. He's a Democrat, as well as myself. And he was elected to his third term in 2018. And something very special that he's doing in addition to that, in 2019, he was elected vice president of the U.S. Conference of Mayors. And it's my understanding that he will be serving in that capacity through 2020. Now, we're going to deal with several things this morning, but the first what we wanted to get to is going to be regarding where are we in this pandemic slash crisis that we have with COVID-19, the coronavirus. And this is a great opportunity to get it right from, so to speak, the horse's mouth as to where we are at this point in time. And then we're going to speak about a tragedy that is taking place. That's regarding the case involving the death of Breonna Taylor. So we'll go some other things if we have time. We're going to go about 45 minutes this morning. And we're just going to get as much of the mayor as we can. So Mayor, first of all, I want to welcome you again to Straight Talk. And I cannot tell you how pleased we are that you would take the time to share with us. I know you're very busy. You got a great schedule. I'm viewing you over all kinds of portals and platforms that you're using to communicate what's going on. But we thought it might be a great chance here at Straight Talk to hear it right straight from you. So, how are you?
Good. I'm honored to be your first live guest, and anybody that knows you knows that you are well known for your straight talk. So I appreciate the name of your show.
Well, thank you. And let me say this to you. I think the viewers would want to know, where are we? Where are we in terms of this crisis? I know we got a reopening coming up. I know we got testing going on. I know there are challenges, or at least there were challenges being reported nationally, and I think even locally with PPE and protective equipment. And there may be other issues that are involved. Where are we?
Yeah, so we've been in this pandemic now over 2 months, and it's gone by with this haze of new information. People are learning about the virus. How do we learn how to manage living with this virus before a vaccine comes out? That is the big challenge we have right now. So as we all know, we were at a healthy at home order for quite some time, up to the resumption of some medical procedures starting about 2.5 weeks ago. And then this week on Monday, there was a gradual reopening of some of our businesses, some of our retail. The big event, so to speak, is the reopening of our restaurants next Friday, the 22nd, where restaurants will reopen at 1/3 capacity inside and unlimited capacity outside, as long as there's still the proper social distancing. So the way I like to look at this, Senator, is there's 4 really critical parts to this phase of the reopening. So first is the gradual reopening. So think about this like a faucet. You don't go from being shut down to just turn that faucet all the way on and it's like back to the way it was, okay? Because we've got to respect this virus and what it can do. It is still out there. It is still moving in our community, in the country, in the world, and it's just waiting for us to drop our guard. So that's why we're going with a slow, gradual reopening. That's one part. The second part then is, do we have adequate testing for the community so we can understand if the virus starts to exponentially increase. And then do we know where it's doing that, so we can identify the individuals that are positive, and those that they've contacted, then they need to go into 2-week quarantine. So if that happens, then you box the virus in, right? It can't move anywhere else because the virus doesn't move, people move. So those are the first 3 parts. The fourth part of this equation, and the final part, is what I just call citizenship. Will people continue to comply on social distancing? Now we're asking people to wear face coverings when they go out in public. And if all 4 of those items work in unison with each other, we're just going to continue to see the reopening of the economy and people moving about, and so that we can learn how to live with this virus and manage it the best we can while the therapeutics improve, and waiting for a vaccine to see. And when that vaccine, we got to wait for a vaccine. That's only when, we get back to quote normal. And one of my goals is that we create a new normal, a more equitable normal on the other side of this pandemic.
Well, it appears obviously to be a balancing act. You have the threat of the virus. There's no question about that. We know that the numbers are horrific across the United States, and we have our own issues in Kentucky, and particularly in Louisville. But also, you have this whole thing about not just the fact that the economy certainly can impact us in other ways if it doesn't start moving at some point at a higher level, but also you got the human factor in between that of people feeling cooped up or disconnected or really readjusting. How is that factored in, or how do you see that as unfolding?
No, I mean, that's a great observation, because you can see that different parts of the country are approaching it different ways. And, at its core here, I think what people want the basic facts and the science behind this deal. People want to feel like their odds of being healthy and safe are strong. And then through all that, they then want the personal freedom to kind of move around like they've moved around before, right? So, but you can't have one without having the other. And so you've seen different states take different approaches toward this. We've been here in the Commonwealth really noted for kind of the calm, measured, informed approach that's been taken in Kentucky and in Louisville. And that resulted in our healthcare system not being overflowed. It's also led to our death count here. While everyone is horrible, you can go across the river to Indiana, for instance. Their population is 50% more than ours, but their deaths are 4 times more than ours. So they went into the healthy at home about a week after us or 10 days after us. And of course, they're releasing their economy about 2 weeks earlier than us as well. So it's this balance that everybody's trying to figure out. It's like some people will say, well, look, people are going to die, get over it. The opposite of that is like, one death to this is one death too many. So we got to go slow. And then we've got the economy. This has been not just a public health disaster, it's a financial disaster, it's a social service disaster. And so all this stuff is what's being juggled right now. And then it adds in that element that you just spoke about, Senator, which is I don't know if we call it impatience. Some people are impatient. Now, the majority of Americans are saying, go slow on this. So other people are saying, we need to be really patient about this. So it's our job as elected officials to kind of figure out what that balance is. And I was just with a few people before this, and everybody was wearing face masks. Everybody was being socially distant. It was outside. So it's a safe environment, right? And you can contrast other people. They're like, these rules don't apply to me. I'm not going to catch this. I don't care. So it's just one of the things that leaders have to have, and everybody can be a leader, is you have to be able to deal with ambiguous circumstances where you don't have all the answers, right? But you've got to say, okay, that's the way it is. It doesn't do me any good to complain about it, but I'm going to do my part, because we all live together as a community and as families. And if one of us drops the ball, that's how that virus can really start spreading again. We're seeing that in Warren County. I don't know if you're following that or not.
I am.
A real outbreak there. So one of the things we say with my team is we have to be humble to this virus. Okay. We humans are pretty arrogant. We think we control nature. I mean, we are nature. We tend to forget that. And this virus doesn't care about us. It just wants to spread.
Yeah. Well, you raise an interesting point in that reopening piece. We're a border state. We're a border city. There's a different dynamic and reality taking place just across the river. And I'm just wondering, what are your concerns in that area, or have you seen any interaction between those dynamics and what's happening here in Louisville?
Yes, I'm in regular contact with the mayor of New Albany and Jeffersonville in particular. And I've also talked to the town manager of Clark County and the mayor of Charleston, Mayor Hodges. So, we're a metro economy, right? That river just happens to be there for all intents and purposes. We're one community here. So having Kentucky and Indiana on different opening timeframes has been a complication. I worked in Southern Indiana for a good part of my early career. And so I have lots of friends there. So but I do think we have to share the data that, their death rates are significantly higher than Kentucky's here, just so people are aware of the risk if they decide to go shopping there, if they decide to go for a meal in Indiana. It does increase their odds of getting the infection. So this is all about decreasing the odds of getting the infection. So they're aware that I'm communicating that way. And I just ask people to be patient, stay focused. We've all worked way too hard to get the relatively decent results we've had for the virus right now to kind of blow it and throw it out the window. We've got the Memorial Day weekend coming up next weekend. Restaurants open next Friday. So there'll be a lot of opportunities now for more movement in the community, but we just still have got to do that again in a safe way. So it would be nice, Senator, if there was a coordinated national response to this, if there was a federal response to the pandemic, both in terms of notifying the community, communities of America, having vaccine readiness, having PPE readiness, but that did not happen in as coordinated as fashion as many people hope. So it's been left to the cities and states of America to kind of figure this out as we go along, and that's been by design from the White House, and they're saying these are state solutions and city solutions. But as a result of that, that's led to some complications, especially when it goes to securing protective personal equipment, PPE, as you mentioned, and tests, paying too much for PPE as you had states and cities bidding against each other. So you've got complications at the federal level and then the state to state level as well. And then so we're just doing the best we can locally to figure this out. We've got a good team. We've been, we had to respond to that hepatitis A outbreak last year through our public health department. And the Center for Disease Controls did say we represented the gold standard in terms of how we reacted to that. So we do practice for things like this, but nothing on the scale of a global pandemic. But all that being said, our team has gotten good marks. We brought on some additional resources to help us, and we'll continue to do that as we move into this pandemic.
Well, I got to say, across the board, and believe me, I've been deluged with so many communications, things that I don't have ready information for. I'm not at the helm like you and Governor Fischer is, but I'm gonna tell you, just universally, what I'm getting is a very positive response from individuals and how Governor Fischer, as well as you, Mayor, are handling this. So I'd like to report that back to you.
Thank you.
And believe me, I'm in a position where people, if they got something to say, they're going to say it. But let me say equally, the national effort is obviously wanting the lack of leadership. People can talk. You can talk all you want. You can claim all the credit that you want that someone else produces. You can talk about you're going to reopen the country when in the final analysis it's the states and cities that are reopening. You can say all these kinds of things, but if you don't provide that coordinated national leadership, that is just extremely disturbing to me and should be disturbing to anyone else. But I want to take you to this level because this is the thing that's really disturbing me. We have Mitch McConnell and some others running around trying to make a blue state, red state issue out of reimbursing municipalities and the state for the funds they've had to divert and and they spend to protect their citizens in a national, a world, but certainly a national emergency. And they're talking about, no, I, this absolutely blows my mind. I don't get it. What do you get from that? I don't understand that.
Well, I'll give you the information as current as what I have it. So in the first coronavirus relief fund, so that was what now, probably 3-4 weeks ago, the House and the Senate and the president signed a bill that sent a minimum of 1.75 million, I believe it was, to each state. And then every city in the country with a population of over 500,000 people received a direct allocation. So in our case, that was $134 million. And that $134 million was restricted to be used just for expenses related to the COVID-19 virus. And absent some really major problem, that's not going to happen, that amount of money. Now, what we have done since then, and what the US Treasury has done, which is writing these regulations, is we've given them all kinds of feedback that we need more flexibility in how to spend this money. So they have loosened up the restrictions on how to spend it so that we probably can access about half of it right now. And why that's important is that our revenue from the city is made up of taxes, obviously, and the number one source of taxes we have, about 50% of our budget, comes from payroll taxes. So when the economy is hit like this and unemployment is at all-time highs, our revenue is in the tank. So that means we don't have enough money to pay for the people that provide the services that our citizens deserve. And so that's the cry that you're hearing from Republican and Democratic governors and mayors that, hey, we need more flexibility on the money that's been allocated, and we need more funds if we expect to get our economy back on track. In our case here in Louisville, our total bill could be about $250 million at the high end between this year and next year. And that's just to maintain, Senator, the public services that we have. Okay, so that's important. Without that, we'll have to terminate 1,000 people's jobs. Many of them are who are first responders. So that makes no sense in the middle of a pandemic. But that doesn't talk about then the support that our small businesses need, our nonprofits need. If our people are not working, the type of woe that we're going to be seeing in our country beyond what we have today will be immeasurable. So that's what we've really got to be thinking down the road here next month, 3 months, 1 year from now, on how this is all going to play out. So yesterday, as you know, and the U.S. House of Representatives passed a bill, they're calling it the HEROES bill, to represent maintaining state and local governments. And then there's a whole bunch of other things on there. It's a huge bill, $3 trillion relief bill. That's equivalent to the amount of money that's been spent so far, allocated so far from the federal government. The U.S. Senate, which is controlled by the Republicans, has said it's dead on arrival. Okay, the bill in its current extent, maybe it's dead on arrival, but America needs help. So they need to say, what do we like in that bill? What don't we like? What do we want to add? So you know this, you're the master of this process. You've represented our Commonwealth and our community for years on this is a starting point for a discussion. But what we do know is that our people are hurting. We need to get money to Main Street in USA so we can get our economy going, so we can help those that need help right now, so we can pull this back together. This virus happened. The people of America now need to come together to help each other. And when I say the people of America, that's the government, right? A lot of people, it's amazing to me, they forget that the government is us.
Right.
We elect the people that represent it. We pay the taxes that support it. So the question is right now, do we want to borrow the money at record low interest rates so that we can get this economy going again? Because if we don't do that, I'm afraid this economic recovery, could take the rest of our careers. It's going to be, and into this walked the chairman of the Federal Reserve, Jay Powell, these past couple of days, that is telling Congress, we need more money out into our country right now to get this economy going. And when he was asked about the $3 trillion on the House bill, he said, we may need more than that. Yeah. So we're in unprecedented times right now.
Yeah. Well, if there's ever a time for leadership here, those who are in position that in some situations have their thumb on where we have to move to, it's disconcerting to me that a spirit of unity is not fostered. It's not fostered by the president. You don't have to say this, I will say it. It's not fostered by the president and his rhetoric and his divisive approach to this, and the way our senator here, McConnell, responds. I'm not asking for a response from you on that. I know that it's important for the city to persuade our circumstances, our dynamics, persuade a better response. But it's I've been in this a little while too. This is disconcerting to me. But look, I want to.
On that, just I think, Senator, the more people speak, I have seen both sides of the aisle respond to that.
Yeah.
And like I said, this is not a Republican or Democratic virus.
Right.
Here, okay. This is a time for us to, and I think part of what I've tried to do throughout this, and it's been complicated here this past week, I know we're going to talk about this in a second, is as much anxiety as you can remove from people right now and as much drama as you can remove, the more we should try to do that. Because this has been a real monkey wrench thrown into people's lives right now. You know, they're wondering about, am I going to have a job? You know, most of the people that are impacted by this, once again, are people at the low income scale of our community who always get the short end of the stick on most everything that happens in our country right now. So people are just trying to figure out, how am I going to live, not just from a health standpoint, but from a financial standpoint as well. And when we don't have basic questions like that answered, that is not going to end up well for us as a country. So the more that we can get in front of that, the better off that we are.
Well, to that point, let me say that the history of this country, particularly with respect to the disparities that exist, are obvious, documented, etc. But you know, even when this is over, I don't expect anything to change unless policymakers and others focus on structural change that's calculated to get those results. And I think, you know, we can go on and get along and go on with it, but we have to focus on it. In fact, I'll put a plug in here for Monday. AAI, the African American Initiative, is hosting a virtual event at 5:30, Monday, May the 18th. That's going to start off. It's going to be a series, and I invite you, if you have time, to look at that and or revisit it. It's going to be streamed Facebook Live, so you can revisit it later on. So there's information. We're going to have some medical doctors and some PhDs, some people who know what they're talking about. And guess what? They're local folk that know this city, they know the state, they know nationally. So you raise a good point there, but we have to make sure that we think long-term, what we're gonna do. We need to learn from this and undo some of the things that we always know is unjust. I wanna turn to that other issue, the very tragic issue that's bothering us all. We all heard about the tragic death of Miss Breonna Taylor, who was killed as a result of police breaking into her apartment on a drug raid. There were no drugs, at least that's what's been reported, or anything else, at least that's been reported of illegal import. So given the long, as we've indicated, documented history of police abuse of the Black community, I mean, it's documented. Yet once again, the questions raised regarding this death at the hands of police, further doing something real fundamental, undermining the trust that must be accomplished and maintained between those who are charged with protecting and serving and the citizenry. Without that trust, you know, and I'm not going to go further with that, but that trust has always been tenuous at best and downright hostile at worst. And it's been since the beginning. Now, Breonna Taylor was a respected up-and-coming emergency medical technician who was in bed after midnight when the police reported that they announced themselves and knocked several times. And I don't expect you to respond to this. I know you're in the middle of something. I'm just sort of laying the framework here. But later said they had a no-knock warrant, which did not require them to announce themselves. Witnesses have disputed that. They've said, no, that didn't happen. Well, that's something that's going to have to be ferreted out, you know, through the process, I'm sure. Her partner, Kenny Walker, roused from his sleep, grabbed his licensed firearm, and then attempted to defend and protect Breonna and himself, it's reported, fired on the intruders, striking an officer. The officers returned a barrage of gunfire, some say in excess of 20 shots, 8 of which riddled the body of Breonna Taylor. You know, I'm saying this and I'm repeating this off a public account, and I haven't said it all, because I think it's important for folks to understand this is not a statistic. This is a real event. It's happening right now. And to your credit, Mayor, and to the governor's credit, you called for an investigation, an FBI investigation, I believe, but also an investigation by the Attorney General. And I think it's been referred or going to be referred to the Attorney General for his review. But we got to get to the bottom of that, because not only must justice be done in this instance, however that comes out, but it has to be based upon what really happened. We got to do the right thing. It raises several questions. I want to raise some of those with you, if I may. No-knock warrants. Should they not be banned or only allowed in the most narrow, I mean narrow cases where there's indicated danger of violence? That's a narrow, I understand that. You know, you got a mob, a gang, and they all hoard up in a place. They all got M16s, etc. Understandable. I understand that. But here are 2 people alone, in bed, sleep. This is taking place after midnight. But let me go further with this. This is not the first time this happened. Across the United States, throughout history, over and over again, we run into this in these no-knocks. I'm focusing on the no-knocks. Should this not be looked at and evaluated and, in my opinion, banned, except in the most narrow circumstances? What's your take on that?
Well, if I could just speak generally about the case. You know, there's an investigation going on right now. There's litigation or lawsuits things. So I can't get into the specifics of the case. And I don't know a lot of the specifics of the case because I'm waiting for all the facts to come out. So just a couple of things. One is what we've been trying to communicate is one about Breonna. Okay. You know, the Louisvillian that she was, the daughter that she was. I've got adult children, you have adult children, and to put yourself in the place of her mom, her family, and think about that. I don't know about you, Senator, but like when bad things happen, sometimes I just wish, can we just roll the clock back, you know, and get a start over on that? Did this really happen? And so expressing that type of humanity for her and the sorrow for her family, an apology to her family, for this tragedy. So I mean, we want to start there. And then second is, how can we assure the community, especially parts of the community that are skeptical that a fair investigation can take place, how do we maximize the odds for that? So that's why I asked the U.S. Attorney, the FBI, and the Attorney General to all get involved with the case. The case will be going to the Attorney General next week. It's substantially complete, but there still needs some forensics and all that, but it's enough for this process to move forward. The third is that America, and white America in particular, if they're not cognizant of how these issues, when there's an officer-involved shooting with the person of color, in this case a Black female, how that does not re-traumatize the Black community and bring up this unequal power dynamic that you said goes back hundreds of years. Yes, until the first ship of enslaved people came here into this country. And then all through slavery, all through Jim Crow, redlining, voter suppression, that issue is still with us, unfortunately, in our country today. Now, we, like many communities, have made progress, but there is a long way to go. So to not understand the skepticism of the Black community around issues like this is something that people have just got to acknowledge, and people have to show empathy toward our African-American communities in America and resolve to try to get to the other side of some type of more equitable society that's not going to come at the flip of a switch, but it's going to come through hard work, and in particular by the majority community. By that, I mean the majority white community that will be in the majority for another 20 years or so, so that we can get back to that structural reform that you spoke about before, because we get the results in our community because of systems that are in place, structures in place, and until they're fundamentally changed, we're not going to get fundamentally different results. And the last point I'll make is just around police and policing. No one disagrees about the essential nature of having a police force. It's then how is policing carried out? And what is the nature of police community legitimacy? And the police are only as legitimate as the community says they are legitimate. It's not something you can tell people that you are. So in policing, as we all know too, it's people that get upset about also understand it is an extraordinary, complicated, difficult profession, sometimes requiring split-second decisions in the middle of chaos. So that's why most people don't want to be police officers. But thankfully, there are some that do. So then I guess last thing I ask our community, because we got a lot of outside, this is a national case right now. So we got a lot of people wanting to tell us what we need to do in our community, and they don't know our community. We should always take input from outside. But we want to remind people that we've been working on issues like this for quite some time. After the Charlottesville demonstration and the putrid displays of racism there by the KKK, by neo-Nazis, that's when we created our Lean Into Louisville conversation series here in Louisville to lean into all forms of discrimination, racial, gender, country of origin. Nobody was forcing us to do that. We said that's the right thing to do for our community. And then out of that came the Synergy Project. The Synergy Project is all about building more police community legitimacy. So oftentimes what you see in communities after a tragedy like this is they announce these kind of things that they're going to do. We have been in the middle of all that, right? So I just put that out there, not as an excuse, but as a reminder to Louisvillians that we know how to do this stuff, and we know how to ask tough questions, and we know how to work through those tough questions. So let's take the best ideas we get from outside the country, but let's develop a Louisville-led solution to this real big challenge we have right now.
Well, let me say this. I agree with you, because there is no excuse. And I'm glad you're not offering this as an excuse, because there is not. But there is something I do know. You know this community. I know this community. And I agree with you. Louisville led on the ground. I agree. And I think we have an opportunity here, Mayor. And I've seen you take advantage of opportunities historically to try to make change. Your whole initiative on a more compassionate city. You know, I thought that was just pie in the sky initially. And after a while, I began to see it translated into behaviors of people that I didn't even expect. So I was impressed by that eventually, you know. But what I'm talking about here is that we do have an opportunity, and I know you recognize it. And I have to go back to this question. This is not this case. I'm talking generally.
No knock.
No knock warrant.
Yeah, sorry, I got so much into my.
No. What you
Yeah.
said is perfect. I'm glad you expressed yourself. That's what this is about. But no knock warrants have a bloody trail. There's no question about it throughout history in many communities. But we have them now. I can, I'm an attorney by training.
Yep.
And I understand that there are circumstances. Police is a tough job. It's a dangerous job. And there are certain situations it's more dangerous than others. You got to plan, etc. But this was not something that was a split-second decision when they got the no-knock warrant and then reportedly put information in there that was not true. That the Postmaster General, U.S. Postmaster General, is now saying publicly that, well, they didn't come by me. What they said in that warrant, that's not me. I didn't do that. We didn't find anything suspicious. So that was not, and let me back off this case, because I want you to be able to respond generally. I don't want you to go, and I recognize the sensitivity of that. Just in terms of no-knock warrants generally, there have been situations in other communities where individuals have been broken into and someone is fired back thinking that they were fired upon. I'm talking about these are documented cases in other communities. probably the facts are different in some way. But the issue of, we got a castle document. Defend your home. That's a big deal. Defend your home. That's your last place. So just in my mind, I'm thinking if you have a no-knock warrant, that this raises a serious question, particularly unless it's narrowly done for individuals. You know, it's a conflict between the castle doctrine and the police desire to enforce the law the way they see fit. So all thing I'm saying about the no-knock warrants is it seems to me that should be done very narrowly. And I just want to get your perspective on it.
Right. So I guess let's just start by saying, you know, what is the purpose of a no-knock warrant? You mentioned that before. So first, a judge has to sign off on a no-knock warrant because there's probable cause. So there's a step there before the police can execute a search warrant with a no-knock warrant. And then they are given, as you mentioned, if there is concern on behalf of the police of imminent danger on the other side of the door, and or destruction of evidence that would be needed to prosecute a case. Those are the conditions, as I understand it. Correct me if I'm wrong.
No, that's correct.
That a no-knock warrant can be given. And obviously, you know, with this case now, people are looking at different cities on that have removed no-knock warrants. Other cities have no-knock warrants. And this is something, at least for the immediate, what I've asked Chief Conrad to say is take a hard look at this right now. And should that practice continue? So that's the phase that we're at locally right now. But what's going to come out of this case? We know will be many questions, right? And that's the purpose of these PIU cases, that there's 100 different PIU cases throughout the course of a year of different types. What our practice is with officer-involved shootings, and we followed it with this one as well, and we've led in this area. I've called for, within 24 hours of any officer-involved shooting, to have a press conference that's preceded by a group of community leaders that look at the evidence that we have to basically say, you know, the police are on track here in terms of where this is going right now, because every officer-involved shooting, as you and I well know, raises all types of tensions and questions in the community. And so that process took place here on March the 13th, which just happened to be, you know, in the beginning of this whole coronavirus haze as well. So a lot of people are just hearing about this for the first time, but this was all public. It was done with the press conference. All that can be still found online. And then when you start a PIU investigation like this, they typically last 2 to 5 months. So we're a little bit more than 2 months into it right now. And so it's not a question of keeping things secret, right? It's just an investigation is taking place like before. So we're in the phase now that, because of some national attention and the super unfortunate tragedy with Ahmaud Arbery down in Brunswick, Georgia, some of the national bloggers have said, well, look, this case with Breonna Taylor is the same thing, which I dispute that. Breonna's situation is a tragedy, but it's quite different than from Mr. Arbery's case down in Georgia. And that's why there's been so much elevation of attention on this locally, which has given us an opportunity to explain a lot of these issues around there, bringing in the FBI and all these other folks. So that's why it's heated up so much this particular week. And we've just, you know, you and I've been in the trenches on different things before. You've got to say, it is what it is, so they speak. So now we've got to say, okay, how do we lead through this? And how do we build a stronger community as a result of something like that? And that's a test for leadership, and it's a test for our community as well. Because it's like when I say about families, you know, families have like high highs and low lows. At least that's my experience in life. But then how do we come off the low lows, right? I mean, we can't divorce each other as a family. We're blood. And the same thing as a city. So the question is, how do we take this moment and build off of it and grieve and recognize any mistakes that it could have been made by anybody to be stronger from this? And I know theoretically that's a really easy thing to say when emotions can be so raw, understandably raw in a situation like this.
Well, let me thank you for those comments, Mayor. Let me say, as a public official, as a father with adult children, as you've indicated, as someone who's represented a number of people in many different challenging situations, the fact of the matter is that two things must prevail. One is justice. However that looks, it must prevail. Justice must prevail, and it must be based upon facts. And I think that's what you're saying. I agree with that. These investigations have to be unfettered, and they have to be transparent, and they have to be rigorous. So the way I'm trained, I'm waiting for those facts to get to an outcome. But I think what's really fired this up is not just that. I think the inconsistencies that are being reported, if those inconsistencies are true, it's raising a whole lot of ire in a lot of people. I'll give you an example. My phone, I issued a statement actually supporting the governor in your position and having this reviewed by the attorney general and the federal level as well, because that's exactly what should be done. But guess what? My phone blew. I got 194 calls in one day on this at my office. Now think about this. It is really blown up. People are very concerned. This is very serious. But you did say something else. Yes, you must lead through this. But guess what? We got to think about also what we have, notwithstanding this, and where do we go after this? Should there not be a top to bottom public review of police procedures in this and other areas, particularly since public trust is at stake here as well? The Black community is necessarily impacted in this trust area because of the historical piece. But I would say that any citizen of right mind and positive import would want a society based upon justice, which we purport to be or strive for. And certainly, if we're going to get along, we got to show respect and trust on every level. Your response to that?
My goal throughout all this, Senator, and will always be anything that we can do to enhance public trust, to increase police community legitimacy. I want to pursue that. So our community, I don't represent any special interest group. I don't represent any special department of Metro government. I hope, I represent the truth. I represent getting to the truth and citizens understanding that. So any practice that we can take to enhance that legitimacy, that truthfulness, we have to pursue that. Because remember, again, I talked about government earlier. Our local government is the people of our community. Okay, it's not me. It's not any department. So the more we can do where the people of the community say, that is my government, that is our government that we're proud of because of the way we work through issues, the way that we find new truths and new practices. That's how you build strength, no matter what the situation is. So this tragedy, unfortunately, has presented us with an opportunity to do that. And this is a time to listen to people's emotions and their feelings and their suggestions, and take all the best ones and make sure it's not just, okay, yes, I hear that. Well, the question is, what are you going to do about it? Okay, at the end of the day, it's about results and it's about outcomes. It's not about you or me being a nice guy or whatever. It's like, what has changed for the better as a result of this tragedy?
On that, we can agree. Mayor Greg Fischer, I want to thank you again for taking the time to come and share your thoughts in a very tough situation all the way around, notwithstanding the challenges with COVID-19 and the health challenges and responsibility that you and others have with respect to that. Thank you for your commitment to those. We all extend our blessings and support to first line individuals who are trying to maintain and protect us in that regard, and those who even work that don't have an option other than to work, but show up every day in the face of danger to keep us moving in this society. So for you to come forward and talk in this way, I look forward to us doing this again at some point, and I appreciate you coming on. I want to turn now to my viewers that on Monday, May 18th, 5:30, we're going to deal with disparities that impact our community through COVID, but beyond that, because historically, we all know the issue of disparities. The question is, what policies do we employ to undo the deficiencies that are present, prevalent, documented in our structural reality now? We're going to deal with that subject matter, and we want you to come again. We thank Mayor Fischer, and thank you for joining Straight Talk with Gerald Neal. And I'm going to try to fumble a little bit and turn this thing off, and I'm going to look for you again next week. Goodbye, Mayor.
Thank you, Senator.